What do you mean it's not latching?
So, think of when you adjust somebody, like when you crack your knuckles, you're actually pushing all the air out of that joint. And when you just crack your knuckles, you just push the air out of the joint, and that's the noise you hear, cavitation. When you adjust someone, a lot of times you push the air out of that joint to your cavitation, but you're actually moving the position of that joint from point A to point B, or bad position to good position. And when it really locks in place, I call it latching. That's just a term I have. That means it's gone all the way to where I want it, instead of like halfway or partially. So you actually can feel that, kind of like a baseball into a mitt versus it pops out. And usually when it won't latch real well, it means there's swelling or inflammation or spasms keeping it from going in 100% and locking in. So what I'm doing now is using tapotment or percussion to continue tapping that joint in the direction we want to go with motion. Motion opening that joint plane up in every direction. Especially for small patients like Wade.
Yeah.